Okay, we are here today to discuss the Council of Cardiology Practice and the E-journal, which the Council is supporting. And I am Dr. Per Anton Sirnes from Moss, Norway. I'm a practicing cardiologist, and with me here is...
Also a practicing cardiologist from Ghent, Belgium. My name is Prof Clement, working for the E-journal.
Can you explain about the E-journal? How long has it been around and how is it functioning?
Well, the E-journal has been there right at the beginning of the council, really. And the idea was that we should bring out papers, short papers, with messages that are clear, short, easy to read, with new information. And that information is clinical, information is technical, but really short to be read in a few minutes. The journal comes out every week. So every week we have a message on a specific new aspect of cardiology that comes out.
So this is the subscribers get an email, they click on it, and then they have an electronic journal with a presentation of a specific topic each week.
Each week, and that is 2-3 pages, never more, with a summary that you can read in 1 minute, an introduction which opens the area where the new information is coming into, and then an explanation that the clinician can read very, very quickly and understand very well.
This is a fantastic way to get updated. Who are the authors of this e-journal?
Well, the authors of such many series of publications are everywhere, but in reality senior authors, because we do not bring only that new information. It is what I always call digested information. That is, around the new information we bring other aspects to introduce the topics and let the clinician reflect, yes, this is new, but reflect there is also this and this aspect. Let us be careful about this and this aspect. So it is not just giving new information, it is more. And therefore, the point of having senior authors, having that sort of experience is extremely important.
The e-journal, is it only in English or is it also translated to other major languages?
It is translated in several other languages. The basis is in English, but it is also, at least for some parts, introduction, the summary in French, Italian, Spanish, German. So we are really covering a quite big part of Europe.
And do you have any sponsorship?
Up to now, there is almost no real fixed sponsorship. We also would like to remain independent, of course. But we look forward in contributions from different entities, from the pharmaceutical companies, the technical companies. We would like to have some people really understanding that is an important part of new message where they can contribute that. Of course, as an independent entity, but so important to contribute to above 30,000 subscribers that read the message. So it is really the area, a forum for many.
The topics that are discussed in the e-journal, is that the whole concept in cardiology?
Yeah, it is the whole concept of cardiology focused at private practice, or at least practice outside of the hospital. That does not mean that we are not talking on aspects in the hospital. Of course, that should be included. But we focus on what the clinical cardiologists really need. And those are heart failure, arrhythmias, the hypertension aspect, peripheral vascular, and all cardiology topics that you see in a regular consultation, really.
And the viewers who want to subscribe to this e-journal, how do they do this? And it is free, is it?
Yeah, they behave on several ways. First, they see what the topic is and they see that doesn't interest me or eventually not. And secondly, we get information for them. Every year, every 2 years, we do a questionnaire and we ask them, what do you want? what are the topics that are lacking that we have not focused enough at. So it is really, it goes in two directions. We know largely what they want, and we try to get this in the series.
But if you viewer now wants to subscribe and does not subscribe, a current subscriber, how to become a subscriber of the E-journal?
Oh yes, this is a practical aspect. I forgot indeed about this. One can subscribe to us by going to the booths of the ESC and say, I want to be on the list of the subscribers of the E-journal. And they put this immediately on the computer, and then with your computer information, you get it almost immediately.
And also on the ECS website, click on the Council of Cardiology Practice. There's a link to be a subscriber of the E-journal.
Yeah, which is important because then you can go backwards. And for example, remember a few weeks ago, there was this or this, I missed that, and you can go back and have all the information just like it was the first day, really.
So 10 years of E-journal is online for those who want to search the specific topics.
Absolutely, and it may be even interesting for those liking to see evolution of things. You can go to a topic like heart failure 10 years ago, see 5 years, and so further on. So it really is interesting for many aspects, but you can have all the papers published. Yes.
Thank you, Professor Clement.
It was my pleasure.